So I'm just going to be talking very briefly about the PhD that I'm doing and the wider study that it's a part of. And then I'm really just going to take the opportunity to share some of the narratives of the mothers that I've been doing research with. And this is just a chance to kind of get their stories across and show things that they're feeling stressed out about, worried about, things like that. So basically I'm a second year PhD student. I'm in the Department of Geography. I'm interested in women's experiences of austerity in terms of their health and well-being, service use and access, their income, benefit receipt, housing, employment, coping mechanisms, basically everything that's going on in their everyday life and how austerity might be impacting on it. So I'm conducting an ethnography with a women's group based in the town centre in Stockton, as well as some in-depth longitudinal interviews with 15 mothers. Currently, I am finishing my fieldwork and beginning my qualitative analysis. I've engaged deliberately with a diverse group of women from across the borough, so they come from all different areas, urban, rural, different incomes, education levels, things like that, to emphasise kind of the spatial and gendered nature of inequalities. So I chose this picture of Sports Direct deliberately because if anything demonstrates kind of a stress-inducing environment, it might be the business model of Sports Direct. So basically I am involved in this study, which is Local Health in an Age of Austerity, the Stockton-on-Tees study, which is headed by Professor Claire Bamber. Why have we chosen to research Stockton? Well, the life expectancy gap for men in Stockton is 17.3 years. That is, I believe, the biggest gap in England. For women, it's 11.4 years, which is still very high. But what I'm interested in is why is it that women are doing better than men, even in areas of intense inequalities? And within Stockton itself, you have spatially very close by, you have people who are in kind of the most, within nationally the most affluent areas, and also the most deprived areas, kind of living almost side by side, just a couple of miles apart. So yeah, just to go briefly through the research methods that I'm using ethnography, which comes from anthropology as a discipline. It means basically writing about people, and it's both a process and a product. Ethnographic research involves participating in, observing, reflecting upon people's lives and social contexts, but also how you as the researcher are embedded within that context while you're present in people's lives. It's a research method that derives data from in-depth, long-term studies of specific social worlds. And the qualitative longitudinal interviewing, basically longitudinal research is used across all different kinds of disciplines. It's interested in investigating and interpreting dynamic social processes and how they shape us. It can produce in-depth data illustrating how cultural, geographical and historical processes interact to produce outcomes and how individuals can respond to and engage with this. So I've been doing repeat semi-structured interviews with 15 women. In terms of the field of health inequalities generally refers to the systematic differences in the health of people occupying unequal positions in society. Women, interestingly, have lower rates of mortality, but they report higher levels of depression, psychiatric disorders, distress, and a variety of chronic illnesses than men. I'm employing an intersectional approach to health inequalities, which means that I'm trying to understand how gender, race, age, sexuality, and other aspects of our identity interact. Intersectionality offers a useful framework because it recognises how individuals have multifaceted aspects to their identity, which influences their relationships to others, to structures of power, and impacts upon their health. Denton et al. Have argued that levels of health are determined by social structures of inequality, differences in health-related behaviours, and psychosocial factors, including stressful life events, chronic stressors, and psychological resources. But the picture is more complex than that. These factors are rooted in the social structures of inequality that define people's lives. So the next section will introduce the stories of 3 women from the study to highlight some of the difficulties that mothers on low income are facing in terms of dealing with intersecting inequalities. So for the purpose of this, I've just chosen 3 women who are all not working and they're all living on a low income. The first lady is Chloe, and she's in her late 20s. She has 2 young sons who both have an autism diagnosis. She recently became a single parent and she's a carer for her children. She volunteers at a local charity and is very involved in local politics. And this quote is from her dealing with postnatal depression. She says, "My son came along in 2009 and it was probably one of the worst times of my life. I had postnatal depression after him for about 6 months before I got any help. The doctor asked if I had any support. I said my mum, but she's caring for my dad. He had just finished his chemotherapy at that time, but we knew he wasn't going to get better. The doctor said, well, you're lucky, you've got more than a lot of people have, and sent me away. No medication, no help. Thank goodness I changed doctors, because it took me a long time to go to the doctor, because we were really struggling with money. So the new doctor gave me some antidepressants and sent me on my way." And in the next quote, she's talking about dealing with the benefit system. And recently she became a single parent and her benefits were stopped for an indeterminate amount of time. Prior to that, her benefits had been stopped on Christmas Day. She believes that someone reported her to the DWP, but the job centre wouldn't give her any information about that. So you can imagine how kind of worried that made her feel. So she said, "The brown envelopes, I'm terrified of them. If one comes through the door, my body language, my heart, the children could be saying anything to me, and I wouldn't even hear it until I've opened it. And it's either nothing or it's like, oh, your benefits are suspended for Christmas Day. And they always come on a Friday when you can't do anything about it. Always. Or bank holiday weekends or something like that. I'm going to be so, so happy when I never have to see another one of those things ever again." And the next lady is called Sally, and she is in her early 20s. She's originally from London. She moved a lot between Hartlepool and London in her late teens before settling in Stockton. She doesn't get on with her parents and she has no contact with her father. She has one daughter who is 3 and they don't live with her partner. Her partner worked in Redcar at the SSI Steelworks before it closed. She spends a lot of time at one of the local Sure Start centres. She takes a lot of courses and socialises with other mothers. So she talks about dealing with ongoing pain while being a lone parent. She says, "I've been to the doctors before. They gave me painkillers that put me to sleep. I couldn't take them because I've got her. I did go back to them and say, look, I can't take these because they put me to sleep, and I can't take them because I'm a lone parent. And they went, oh, well, you're going to have to suffer with it then. I struggle with a bad back as well after having the section, so I'm contending with a bad back, a 3-year-old, and tidying up. I won't take any medication because I'm caring for her. I've had physio, I've had spine rehab, and I do a few exercises for my back every day, and I just carry on. It's got worse in the last few years. As soon as she's in school, I'll get it seen to." And she talks about managing her partner's expectations, which came across as a very stressful thing for her in our interviews, because he comes over a couple of nights a week and really disrupts this fragile situation that she has going on with her daughter, where everything is just so, and then he comes along and just kind of shatters that. So she says, "My partner keeps going, oh, you've got to get a job soon, even if it's just in a care home. And I go, I don't want to work in a care home, I'll be miserable. I'm not going to just go out and get a job because he says I need to get a job. I'm not doing it. Plus the work wouldn't fit around her because it can be late at night or in the middle of the day or whatever. I want a job to fit around what she's doing, and he doesn't understand that. I'm a full-time mum and he just comes and goes. He doesn't understand how much it takes to look after her. That's what being a mum's about, making sure everyone's taken care of. I go, my back's hurting, and he says, oh, just sit down for 5 minutes. But he doesn't offer to help with anything. Just sit down, you can do it in a minute. Well, if I sit down, I won't get back up. I have suffered with depression. I still have it, I think. I do still sometimes sit there and just burst out crying for no reason. And I think it's from when I had her. I think it was that we don't live together, and so all of the pressure's on me. Everything's on me." And finally, we have Rose, who's in her early 50s. She's originally from Wiltshire, from a military family who moved around a lot. She's married and has 2 children from a previous marriage. She has an array of long-term disabilities and chronic health issues. She lives with her very attentive husband, her daughter, and her 2 dogs whom she adores. So here she talks about being in a period of crisis and asking for help. We asked for help, we went to the housing for help, all these people for help, and nobody would help us. I suffer from serious depression, so my mental state was just on the floor. I hate being like this. I hate not being mobile and not being able to work. I wasn't bothered by the rent and that when we were both working, do you know what I mean? We could do that, even though we struggled. I feel really let down. I want some answers because I know there's something wrong. I can understand all these x-ray machines and stuff trying to find out what's wrong, but there must be something else they can do. They can't just I know it's not in my head. I've been fighting for 15 years for people to admit there's something wrong with me. It wasn't about the money. It was never about the money. It was about somebody saying, yes, there's something wrong with you. She's referring there to getting PIP, which she eventually got. And then she talks about suffering with mental and physical health issues. She says, the doctors at the hospital accept that I'm in pain, but say there's nothing more they can do for me. Nothing shows up on the scans, even morphine doesn't touch me. I'm on 3 lots of medication for pain. When I went to see the psychologist there, I said, I feel like I've got 2 depressions. One's for my physical health, and the other's for the mental stuff, the emotional things. I said I wanted to concentrate on the emotional things first, which I've been trying to do with no success. I'm still fighting the depression and all of this. I've come to the point where I feel like there's nothing more I can do. Everyone's just waving me away. And I just have one quote, which is from the stakeholder perspective, from Tara, who's the manager at the anti-poverty charity where I've been doing my ethnography. And she was just kind of giving me an overview about lots of the very low income, very precarious women who I wouldn't have a chance to meet because they didn't come into the women's group to access the services. And she says, some of the women I work with have a physical issue, but it's predominantly, it's an anxiety, it's depression, stress related. Quite a lot of them have quite chaotic lifestyles as well. They could be coming from an abusive relationship, maybe they're just young and they've had a child. A lot of them don't have a very good relationship with parents, siblings, so they're not dealing with that. Some have issues with drink, alcohol, but then what had happened is people say, well, if you can afford drink, you should be able to afford food. But for them, the alcohol is a relief at that time. It might not work long term, but for short term, it makes them feel that bit better, and they're further stigmatized for that. But mostly, it's anxiety and depression. I can't stress enough how many people won't come out of the house. A lot of people don't access other services. It's only after a few months of meeting them that you find out the true extent of their debt, their mental health problems, their other issues, because they're not going to open up on day one. If you get behind the door, that's a massive step. So just some brief reflections. Underlying all of the interviews was the thread of managing, and that managing was mostly for other people, actually. Managing the budget, the food shop, caring for aging parents, for their children, for other people's children, and dealing with benefit changes and other austerity measures and welfare reform. Of the 15 women from a wide variety of incomes, only one, who's the mother with the highest income and the most secure family situation, didn't mention experiencing any mental health issues. That's not to say that she didn't, but that just didn't come up in our interview. For the women at the lower end of the income spectrum, poor physical health and poor mental health were common themes. Furthermore, narratives of perceived failures of medical care, of counselling services, of being offered drugs when they wanted holistic care were common. And I don't want to emphasise kind of how the medical care, to overly emphasise medical care, but when they are experiencing poor physical health and poor mental health, they engage a lot with doctors, they go to the hospital a lot, so they're more likely to have experiences with doctors and have strong opinions about that. All of the women had wonderful experiences of their pre- and postnatal care. They spoke very highly of midwives, health visitors, and doctors. In the wider picture of the life course, there's a patchwork of dissatisfaction with medical care and of multiple stressful life events which emerges, often made worse by the benefit system and by welfare reform. With ongoing austerity cuts and cumulative effects, we can expect the situation in low-income areas to worsen. So thank you, and thanks to all of my participants for sharing their stories. I thank you for listening.